So good afternoon, everybody. There are a lot of familiar faces here, which is really nice to see. So I'm Natasha Jordan. I'm one of the rheumatology consultants at Addenbrooke's hospital. And one of my main areas of interest, as many of you know, is lupus. And I work very closely with Jane and with Frances Hall, who's going to speak later. So I really want to thank Sheila and Davina for the fantastic efforts that you've made. And this afternoon you've attracted such a fantastic crowd, and well done, and thank you for inviting me. So I'm going to talk about an issue that I think is a universal problem for patients with lupus, and that is fatigue. And I'm going to talk about the causes of fatigue in lupus and then the management of those. So fatigue is an overwhelming sense of extraordinary tiredness or exhaustion that is not relieved by rest or sleep. And this schematic here shows many of the words that patients describe their pain in these terms, their pain and fatigue. So fatigue is a feeling of weariness. It's more extreme than straightforward, simple tiredness. And people who experience fatigue may struggle to do even straightforward, simple tasks. So things that should be easy become challenging. And frustratingly, fatigue comes and goes for no reason, out of the blue and without any warning. So there's physical fatigue, your body and your limbs feeling heavy, everything seems to be an effort. Some patients describe this as feeling as if they have a perpetual flu. Your energy is drained away with just simple tasks. But there's also mental fatigue. So patients very often tell me they can't think straight, their memory doesn't feel like what it used to be, their concentration and their motivation is low. And then even more upsetting is emotional fatigue, feeling irritable, tearful, or feeling down. So what are the causes of fatigue in patients with SLE? Well, there are many causes. It's not one single thing. So this schematic shows many of the contributors to fatigue, and it's likely that in a single person, a number of these causes are adding together to produce the fatigue. And one person to another, they may be different contributors, or they may contribute a different proportion of the fatigue. So active disease, so if you have very active lupus with high levels of inflammation, that will undoubtedly contribute to fatigue. If you have a long-term condition like lupus is, that is more likely to cause fatigue than an illness that lasts for a week or two. Drug treatments, so this is a little bit tricky because the medications that we use, we would hope either directly or indirectly treat your disease and hence should improve fatigue. But we do have patients from time to time where a particular drug does not agree with them and may enhance fatigue, but that's very much on an individual basis. Pain, so this is a huge area. I have yet to meet a patient come to me in clinic and say, I have really high pain levels, but you know what, my energy levels are fine. I don't think it's possible. So if you're in pain, your body's actually consuming a whole lot of energy just by being in pain to that degree. Poor diet is not going to help fatigue. Muscle weakness. So muscle weakness, there are a number of causes of this, but the commonest cause is if you're tired and fatigued and if you're in pain, you're going to be doing less exercise than you maybe have done in the past, and you'll become deconditioned and have muscle weakness. And this is an issue I'm going to talk a lot about later on. Overdoing it. So a lady told me in the hallway outside, was recently feeling very, very well, had some steroid therapy, and then did a whole lot of work in one day and then very much paid for it the next day. So how to rationalize your energy output and manage your fatigue, but still do the things that you want to do within reason without overdoing it. And I'm going to talk about that later. Stress and anxiety contribute to fatigue, as does low mood or depression. And sleep disturbance is a really key area that is linked with fatigue. So fatigue is the single most common and debilitating daily symptom reported by patients with lupus. The prevalence or the frequency of fatigue is from 50 to 92%, so vast numbers of patients. And severe debilitating fatigue is reported by greater than 50% of patients with lupus. So just to lead on to some factors that are maybe slightly more lupus specific and associated with fatigue, I'm going to talk a little bit later about fibromyalgia, which is a chronic pain condition. And we think that approximately 25 to maybe even up to 30% of patients with lupus have coexistent fibromyalgia. So it's important that as well as treating the lupus, that you identify fibromyalgia if it's present in that particular person, and then target some treatments to help with that aspect as well. Mood and sleep disorders contribute to fatigue in lupus. As I said, physical inactivity and deconditioning, obesity, disease activity, and other non-lupus factors, but factors that we see quite common in our lupus patients, such as anemia or thyroid disorders. So particularly an underactive thyroid or hypothyroidism. About 20 to 25% of patients with lupus will have an underactive thyroid, so it's important that that's checked. So just to say a little bit more about fibromyalgia. So fibromyalgia is a chronic pain condition. There are three key features in fibromyalgia. One is generalized pain throughout the body, and the diagrams here show some of the main areas that are tender in a person with fibromyalgia, but indeed they can be tender anywhere on the body. The second feature is fatigue, and the third feature is poor quality broken sleep, or what we call non-restorative sleep. So they're the three key features of fibromyalgia, but there are other features as well. So as I said, this is a very common problem in lupus patients. It can be a huge contributor to fatigue, so it's important that your doctor looks into that and considers, well, do you have fibromyalgia as well, and maybe they can help you with that. Now, there have been a number of studies looking at sleep disorder in lupus. So this particular study is from quite a number of years ago now, was from the lupus unit at St. Thomas's Hospital, and they looked at 40 female lupus patients and 10 healthy controls, and they studied their sleeping pattern overnight. They had EEG monitoring, which is looking at brain waves, and they also looked at what they call the respiratory disturbance index, so looking at your breathing pattern during sleep. So what they found that in lupus patients there was reduced sleep efficiency, so how well lupus patients slept was not as good as the healthy controls. There was increased time awake after sleep onset, so waking up later on in the night. Lupus patients had more light or superficial sleep, so not the deeper quality sleep. And 15% had breathing alterations during their sleep, which is in a way a marker of the sleep being not good quality. Now, sleep apnea is something else to look out for. So this is where a person stops breathing for just a very short period of time during sleep. It's more common in patients with a higher body mass index. And the pointers to look for that are a history of loud snoring, or what we call daytime somnolence, or being very, very sleepy in the daytime. So overall, this study found that lupus patients definitely had what they called abnormalities of sleep architecture, so looking at the quality of their sleep. But it was not the overall explanation as to why these patients with lupus had fatigue. It was part of it, but not the whole answer. So this was another study, another large group lupus centre in Toronto, where they looked at 100 patients with lupus. And they assessed these patients using what they call the Pittsburgh Sleep Quality Index. And what they found was that 56% of the patients in the study had poor quality sleep. And they found some factors that were associated with poor quality sleep, and they were depression, prednisolone use, and the higher the dose of prednisolone, the more it impacted on sleep, functional disability, and lack of exercise. So there is a little bit of controversy as to how disease activity in lupus is linked with fatigue. I think it's very clear that if someone has very high disease activity, if they have a lot of ongoing inflammation, that they will have fatigue. It's not as clear if someone has very low-level lupus activity or if their lupus is in remission, because very many of those patients will still have fatigue, but actually the inflammation is low. So it's a little bit controversial. So this has been looked at in studies, comparing fatigue to some of the disease activity indices that we use in clinical trials. So one of the ones we use is called the SLEDAI, and no correlation or no link was seen between fatigue and SLEDAI scores. And then using another score called the SLAM, well, they found a good correlation between fatigue and the SLAM score. So as I said, this is a little bit controversial. I think this is because, as I said before, fatigue is not caused by one single thing, but many different aspects contributing their own element. Now, aerobic fitness, I want to spend quite some time on this. So again, this was a study, this is over 10 years ago from St. Thomas's Hospital, where they compared lupus patients. They had almost 100 lupus patients with sedentary controls. So these were healthy controls, but there were people who didn't have a very fit and active lifestyle. And they found that the patients with lupus were less fit, had reduced exercise capacity, reduced muscle strength, poorer quality sleep, more depression, and the lupus patients experienced more fatigue. So now that we've examined what are the potential factors that lead to fatigue in a patient with lupus, I now want to talk about, well, how can we maybe manage and tackle those factors? So it's multifactorial. I think our key thing in all lupus patients is to identify and treat active lupus in the first instance. It's important to also identify any coexistent other diagnoses, so anemia, thyroid, depression, fibromyalgia. And then there have been a lot of studies looking at different interventions and their impact on fatigue. So one of the studies, many of the studies in fact, looked at psychosocial interventions, including cognitive behavioral therapy, counselling, psychotherapy, and biofeedback techniques. And what happened was there was what we call a meta-analysis. So that's when one study takes into the account the results of many different studies and gives a kind of overarching an idea of what those studies show. So this particular meta-analysis looked at the results from 5 what we call randomised controlled trials and 2 non-randomised trials. Then pooled all the results together, and overall there was no good strong evidence that psychosocial interventions reduced fatigue. Now, that's not to say that these interventions are not any good. They do have an important role for patients. Specifically, this study showed that these interventions improved psychological distress and they improved the patient's problem-focused coping ability. So they do have an important role, but their actual impact on fatigue, it was not that pronounced. So going back to aerobic exercise, this was a study looking at lupus patients, and the patients were put in an exercise group. The other groups were a relaxation group and a control group that didn't have any intervention. So there were 3 groups. And one of the basic outcomes of the study was after the patients had had their intervention, whether they felt very much better. And in the exercise group, so they had a guided exercise program from a physiotherapist. So the exercise group, 49% of the patients felt very much better after the intervention. In the relaxation group, 1/3 of patients felt very much better. And in the control group, 16% felt very much better. However, when the study was completed and there was no longer a guided exercise program or relaxation program, and then 3 months later the patients were followed up, there was no difference between the 3 study groups. And the main reason was that out of the 40-odd patients that were in the exercise group, only 8 managed to continue to exercise regularly. So this is a really challenging area. So in conclusion, the overall thoughts that came out of that study were that graded exercise therapy led to an overall improvement in lupus patients. Fatigue actually improved with exercise, and exercise capacity, or the ability to do exercise, improves with exercise. So what that means is the more exercise you do, the more exercise you're able to do. And this is very important. So if you take home one idea today, I think this should be it. The exercise did not cause a flare of disease activity. And this is something that patients are very worried about. They think if they exercise or overdo it, are they going to induce a flare of their lupus? And patients discuss this with me very frequently in clinic. But there was no evidence from this study that that was the case. So several other groups have also looked at the effect of exercise in lupus patients and what happened with their fatigue. So again, this is a meta-analysis looking at the results of 7 studies, a mixture of non-randomised and randomised trials, and generally overall, fatigue improved with exercise. So to conclude on exercise interventions in fatigue, overall there is very good evidence that regular exercise improves fatigue and that it's safe. There is no clear evidence of harm or increased lupus flares. However, the main problem and challenge is that many patients still find it very difficult to exercise on a regular basis because of fatigue, which is what we're trying to treat via the exercise, so it's kind of a chicken and egg situation, and because of pain. So even with these exercise studies where there was supervised exercise in a program form, when the studies finished, it was hard, very, very hard for the patients to continue that outside of the study setting. So sometimes we like to talk about coping with fatigue in the context of what we call the 4 Ps. And they are problem solving, planning, prioritising and pacing. And I think a lot of these things hark back to what Davina said in her opening statements. So as the song says, it ain't what you do, it's the way that you do it. So if you want to look at the tasks you have to do in any given day or any given week, you may need to problem solve and plan and prioritise and see how you think you could maybe do things differently that would benefit you. So you might start to notice things like if you do a very arduous task in the morning, that by the afternoon you're very fatigued or you're in a good deal of pain or discomfort. So if you identify a task that gives you a problem, you might want to ask yourself, well, how can I do that differently the next time? Some people like to keep lists or notebooks or a chart or diary and plan the things they want to do in a given day or over a week. So maybe that very energy-consuming task should be spread out over a number of days. So you pick a big task and then have some smaller, more relaxing tasks the same day, so as not to overwhelm yourself. So you can make a list and put the important tasks on the top, and then grade them in order of how important they are or how tiring you think they're going to be. And you may need to ask yourself the question, well, does this particular task need to be done today? Do I need to do this task at all? Can I actually cross it off my list? Do I have to do the task, or can I delegate it to somebody else? Or maybe someone else can do part of the task and I don't have to do this single-handed. So we all know the story of Aesop's the hare and the tortoise. So I think pacing is very important as well. It's pacing your energy output, breaking down these tasks into achievable chunks that are more manageable. So if you're in, say for example, an office job where you're sitting all morning, something as simple as changing your position regularly may be surprisingly helpful. And it's very important that you don't use extreme exhaustion as a guide for when you need to stop. You should have stopped way before that point. So to learn the fatigue levels of your own body and when to stop and rest rather than leaving it when you've actually crossed the line into exhaustion. Now, talking with family and friends, this is extremely important. A lot of patients come to me in clinic and say that they find fatigue very difficult because no one can see it. It's an invisible symptom. And something that I hear this very often, people say, you know, my friends say to me, you look great, you look so well, you must be doing really, really well. And while that's a compliment and it's meant well, it can actually be very disheartening because you might not feel like that inside. So many people with fatigue worry that they don't want to tell their family or friends just how much the fatigue impacts on their life. They don't want to be seen as that they're moaning or groaning, or don't want to be seen as a burden. So it's a difficult symptom to communicate to someone else. And this can lead to frustration and anger and pent-up resentment if you're not telling your loved ones exactly what's happening with fatigue and how it's impacting on your life. But if you don't tell your family and friends how you're feeling, they cannot know, and they cannot know how they can help you. So I think it is very important. And I hope, as well as patients today, here in the audience, we have a lot of family and friends, because this is a very important message. So if you share the effects of fatigue with your loved ones, they can then understand why there'll be certain activities you want to opt out of, and you don't have to feel guilty. They'll understand, or they may understand why you need to take more time to rest, and give you allowance for that. So learning to say no is another part of that. So we all want to say yes to everything our family and friends ask, or our work colleagues ask, but it's not always possible. But you feel you should say yes, even though you know what you're saying yes to is going to leave you feeling exhausted. So patients with fatigue find themselves agreeing, never saying no. But it is okay sometimes to stand back and say no to certain activities, and I think people will understand that if you explain it to them. So saying no doesn't mean you're not going to take part in an entire activity, say for example a day out. It may be that you'll take part, but you need your time to rest. It may be that your daughter asks you to babysit your grandchildren. Saying no once doesn't mean you're going to turn her down every single time that she asks. So saying no now, don't feel guilty about it. People will understand. And this is a very important first step in self-managing your fatigue. So physical activity I've talked about quite a lot. I think if you've very much gotten out of the habit of physical exercise, you can't suddenly start exercising to extremes, because it's really not going to work out. So the idea is to start low and go slow. So starting with a 5 to 10 minute walk and then gradually increasing that. You will have bad days where you can't do anything, but don't then just give it up altogether. Just slowly build up. So it's little and often. So very often in the clinic, when I have patients that I want to encourage them to start exercising, I think they need some extra help. I'll refer them to physiotherapy for what we call a graded exercise program, so that you feel, well, you have a professional giving you advice, telling you what exercise is safe and reasonable. I think you have a bit more confidence then. Also, physio have a very nice treatment called hydrotherapy, where you do exercises in very nice warm water. And it's another nice treatment to start, just the first step towards exercising again. Another physical treatment that I very often refer patients for is called occupational therapy. And occupational therapy is very useful in that they will work with you on goals. So specific goals, and tailor a plan for you towards graded increase in activity. So they'll be able to shepherd you through starting activity again and gradually increasing it. Stress and anxiety, I mentioned earlier, are also contributors to fatigue. I think probably the key thing in dealing with stress and anxiety is actually realizing that you're stressed and anxious. And different people have different ways of dealing with stress and anxiety. Different things are relaxing for different people, be it reading, exercising, music. Everyone has their own particular thing, but it's about making time for yourself and giving yourself a chance. I have a couple of slides about sleep, because again, I'm quite often asked about this in clinic. So I've listed a few tips here that are common sense, but we don't always adhere to them, that are basic tips to improve sleep. So it's important to wind down before going to bed, rather than going to some very stressful environment and expecting to sleep straight away. Reducing caffeine intake, particularly the latter half of the day. Avoiding alcohol after the early evening. So some people say, well, actually, if I have a drink of such and such, it helps me sleep. It's not natural sleep, it knocks you out. It's not really quality sleep that you'll have after that. If you have pain, so again, we talk about this in the clinic quite a lot. So what I would suggest is it may be useful to take a painkiller before going to sleep, or have a painkiller and a glass of water beside your bedside, so if you wake in the night, it'll be there and you can take it then. Other tips: make sure your room is not too hot, too cold, too bright, too drafty, too noisy. Make sure your bedding and mattress and all of those things are comfortable and of good quality. Remove any disturbances like an annoying ticking clock or a snoring husband. Daytime napping, we talked about earlier. So daytime napping, I'm going to get myself into trouble here, because some people really rely on their daytime nap, but for other people it's actually quite a big hindrance. So a lot of patients say they don't really sleep at night, but they have a 2-hour nap in the afternoon. So with the napping in the afternoon, you're interfering with your natural sleep cycle, your circadian rhythms, so you're almost putting yourself into a perpetual state of jet lag. Some people can sleep in the afternoon and still sleep at night. I'm not one of those, but a lot of people can. But for most people, they cannot do that. If they sleep in the afternoon, they don't get deep quality sleep at night. So it's very difficult, it's very hard for people to give up that habit of napping in the afternoon. So I think this is another one that's very much on an individual basis. Again, this is something I'm asked about at almost every clinic. Is there a particular thing I should eat that will help my fatigue, or a particular thing I should avoid that will help my fatigue? And really, my advice on this is just eat a well-balanced, healthy, varied diet. There aren't specific foods I would tell you to necessarily avoid, or things that you should, eat exclusively. So just common sense, I think, should prevail. And to eat regular meals. So to summarise, as you can see, fatigue is not caused by one isolated issue in lupus. This is very much a multifactorial problem. It's important then to address this in bearing that in mind, that treating fatigue in someone with lupus, it's not targeting one specific area, but taking that person's whole life and issues into account, looking at the overall picture. So I hope you found that useful. I'm sure you're going to enjoy the rest of the afternoon, and thank you very much for your attention.